Feeling like your crown or implant is loose? Don't panic, but don't ignore it either. Because while there's a difference between an implant crown being loose and a crown on a natural tooth being loose, they both need to be addressed and the solutions are different. Here's what you need to do and when you need to act fast. First, you have to figure out, is this a crown on an implant or is this a crown on a natural tooth? Because the situations are different and the treatment is different. If it's a crown on an implant, we have to figure out if it's the crown itself, which is just the tooth, the part you see in the mouth, or if it's the implant, which is the part down on the bone, which holds everything together. If it's a crown on a natural tooth, we need to figure out if the crown is just loose or if the whole tooth itself is moving. In both situations, if it's just the crown that's loose, that's the best possible scenario because a lot of times it's just as simple as cleaning up the tooth, putting a new layer of cement, and putting it back in there. That's the ideal scenario. When it's not just as simple as the crown itself is loose, the solution is a lot more involved. Secondly, it's very important that you don't try and fix it yourself. If the crown comes out, absolutely save it, bring it to us. We can make an assessment and figure out the best way to take care of you. But if it's just loose and moving, don't sit there and play with it and keep on wiggling it because you're not going to make the situation better. A loose crown needs to be addressed, and the best way to address that is to let us take care of it for you. And whatever you do, please don't try gluing it back in. I've seen many times super glue in the mouth, and those two things just don't mesh well together. There's a good chance if you do that, you can make it worse and possibly have to redo the crown or damage the tooth, which in the end is going to cost you more money and time. If you notice that the crown is loose, please call your dentist. That's something that needs to be addressed. It's not something that's going to miraculously tighten back up or fix itself. In my 20 plus years of dentistry, I'm yet to see a crown fix itself and go back and re-cement itself without help. A loose crown on a tooth or an implant can lead to a lot of problems down the road because what happens, the margin or the edge of the crown is not closed off, and so bacteria can sneak under there and cause a lot of inflammation in the tissue. It can cause a cavity underneath the crown. It can cause a lot of problems that if we address it earlier and catch it, it's an easily solved problem. If you allow it to go on for a long time, a lot of times at that point, it's not just as simple as re-cementing the crown. Number 4, and this may sound like common sense, but avoid hard foods, avoid sticky foods, avoid anything that's going to cause a lot of force or chewing on that area, because if the crown is misaligned and you put force on it, you can damage adjacent teeth or the opposing tooth. So here's what I mean by hard or sticky foods. No taffy, no sugar daddies, no hard nuts, even crusts like a hard French bread. Avoid those things because you don't want to run the potential of damaging that tooth. So keep the food soft and try and chew on the other side until you can get in to see your dentist. Here's how you know it's an emergency and you need to schedule something even sooner, that it can't wait. You're in pain, you're bleeding, it feels like the entire tooth or implant is coming out and your bite is off. So if you find yourself in that situation, you need to call us immediately. In an ideal situation, that loose crown could be simply just re-cemented on there. It always reminds me of, I had a patient who had a loose crown and he kind of ignored it and let it go for weeks and it became months, and then all of a sudden the crown broke off and part of the tooth was inside the crown, and at that point we couldn't save the tooth. And I really feel that if we had gotten to it earlier and cleaned everything up, it might have been just as simple as re-cementing the crown on top instead of having to go down the whole road of losing that tooth and replacing it. Which, by the way, takes so much more time and money than just re-cementing the crown. If you have a loose crown on a tooth or an implant, don't panic because there might be a simple fix, but also don't wait because the longer you wait, the more you run the risk of further complications. If you're not sure what's going on, give us a call, come in for a quick check, and hopefully it's as simple as re-cementing the crown and you're on your way. We're here to help you figure out and get you fixed up. Click on the link below, drop a comment, give us a call, come see us, we'd love to help you out. I'm Dr. Brett Langston, I'm here to help you watch your mouth.
Down in Brookhaven with a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on parts, the dumbest you've ever seen.